Well, good morning to a very spectacular Wednesday morning in Carlisle. It's just absolutely beautiful after a torrential rainfall last night, but we're filming this on Wednesday, the 16th of May. You'll probably see this next week sometime. And we've got a great program for you this morning. I'm personally very interested in the main topic of our program, which will be presented by Lucilia Prates, who is Executive Director of the Mass Senior Medicare Patrol Program. So we'll get into just what that means in a few minutes. And Nancy West is with us from the Friends of the Carlisle Council on Aging. Angela Smith is with us. I'm not quite sure what she does, but she has something to do with the COA, I believe. And David Klein is here to kick things off. David, hi. How are you? The Executive Director of the COA.
Thank you very much, Kerry. How are you doing today?
Great.
Good. I understand. I actually don't have any upfront announcements except to say we're entering summertime, and soon enough we're going to have to be outside with short sleeves and shorts and be wearing our sunscreen and taking care of ourselves in that manner. And I just want to wish everybody a happy spring and summer. But I think we do have an announcement on that along those lines from the Department of Health here in Carlisle, don't we?
We do. Funny you should ask.
Okay.
This is from the Department of Health, and it's all about tick bites, basically. And I know everybody has had at least one in the last 10 years, but we now have a program sponsored by the Board of Health where you can get free testing. If you find a tick on you, crawling on you, or digging into you, either one, use the tweezers and pick it off, put it in a plastic bag, and seal it. And then you can go to www.tickreport, that's TICKREPORT.com, and click Order to register for a free testing. And the testing will be for not only for Lyme disease, but for babesiosis, did I pronounce that right? And anaplasmosis. So all three will be tested for absolutely free. You'll get a test result back in 3 days. They'll email it to you, so when you send it in, you include your email address. But that's a $25 value, brought to you by the Department of Health. And if you have any questions, give the Department of Health a call here at Town Hall, or go to our town website. There's more information about it there.
Oh, and the exciting thing is that our town website, people will probably notice this soon, is the long-awaited update is right around the corner. The staff is being trained on it this week, as a matter of fact.
So when will they see it?
I think it's a matter of weeks. I mean, I could say next week, but I don't want to be blamed if it's not next week. But I think it's getting very close. Right.
That's
right.
Good. That's very good.
But it will have a nice, cleaner, easier to navigate look to it. It might not be perfect. And as a matter of fact, I'd ask people to be a little bit patient in the beginning, because we haven't been able to update the old website since January. So we do have some updates that need to be made that have happened in the interim that I'm sure we'll all kind of look at our own departmental pages and try to work on.
Well, I know the COA part of the old website has always been pretty well up to date, and it's been great. So,
right, we try, but I think this is going to be good on two levels. It'll be good for, most importantly, for town residents, because they'll be able to find things a little bit easier. But it will also be good for staff here who are doing the updating, because the current system, or the old system, was somewhat clunky to update.
Right. Okay. Nancy West, welcome.
Thank
Good to
you.
see you.
Thank you.
The Friends of the COA is a very important part of this whole picture in terms of services and programs offered by the COA. Would you like to elaborate on that a little bit?
Sure, I'd be happy to. The Friends of the Carlisle Council on Aging supports a range of programs and services for Carlisle seniors. Among those many programs and services are food assistance, transportation assistance, fuel assistance, also cultural programming, educational programming, also exercise classes, also the use of medical equipment. We have numerous programs already set up for fall. We have a tour of Clark Farm scheduled for May 23rd at 1:30, which Carlisle seniors and others are invited to join us on. And we accept donations any time of year, but we just finished our Mother's Day fundraiser, which was a lot of fun. We encouraged people to make donations in honor of their mother or in honor of anybody that made them think of Mother's Day and of the special things about mothers. When people did that, we then acknowledged the mother that they were honoring by writing a card of thanks of our own. And we are happy to do the same thing for Father's Day. So people who would like to make a donation in honor of a special father, their own or someone else's, should go to the donation site, which is carlisle.org/FOCCOA. And make a donation, fill out the notes line telling us who it's in honor of and how we can notify that person that they have been so honored.
That's Carlisle, FOCCOA,
Yeah.
Friends of Carlisle Council
on
on
Aging,
Aging.
exactly.
Right?
Yeah.
Okay, great.
Yeah.
All right, terrific. I think that you've just had your plan. You plan to have an annual meeting coming up, but by the time we see this, it will either have happened or won't have happened.
Well, certainly our hope is that it will have happened without a hitch, yeah, and that's coming up this Sunday, the 20th.
Well, I think the program was planned is for, and I know we're not supposed to be talking about this because
Totally
it
fine.
may not happen, but the program is someone talking about astronomy and wine growing in Carlisle.
Yes, exactly. It is an astronomer and wine grower, grape grower, winemaker, Mark Reed, who will talk about travels and astronomy and wine. And then, of course, we also have our favorite barbershop quartet performing, and that's the Second Wind Quartet, performing as part of the entertainment for our meeting.
Well, it's always well attended and always interesting.
Yeah, we're
So,
looking forward to it as
that's
always.
terrific.
Thank
And-
you.
And Carrie's one of the Second Wind.
Multi-talented.
That's right.
Absolutely.
Okay, Angela, thank you very much.
Well, we can talk about a few things that are coming before Lucilia gets on. We do have a number of lunches in June before we go into our summer schedule, which is a little bit slower, although we do have some intergenerational programs set for the summer. So we hope that people with children will join us through the rec department as well as our seniors over the summer. But for coming in June, we do have a Chelmsford Crossing lunch on June 6th, and we're going to have a talk about fraud and identity prevention, identity theft and fraud prevention, rather. And that's going to be done by the Better Business Bureau and by Robert Putnam of the Office of Consumer Affairs. I think I was up too late last night. And then we have our regular COA luncheon, which is going to be on June 21st at FRS. And Steve Golson is going to bring us pictures of the eclipse. He went to Wyoming, and he takes amazing pictures at night, and so that should be very interesting. And in this very room on July 9th, we're going to be joined by the fire department and police department for our annual potluck patio picnic. And so all the seniors are invited for a barbecue and bring some side dish or dessert. And we'll have the police and some firefighters here, or at least Chief Flannery, visiting us. And we're doing something a little bit different on June 18th, which is going to be at the Congregational Church. The high school music department offered to do a concert for us. And because they offered to do that, we wanted to ensure that we got as big an audience as possible. And so we decided to offer a free breakfast. And so we're going to have not a not a men or women's breakfast, but a senior breakfast, followed by the concert on June 18th. So we hope people call and sign up for that.
Is your husband cooking breakfast
He
again?
is.
Oh, boy. I'll be there.
So he's working on his menu and trying to figure out how he's going to cook for a much larger audience than the usual men's breakfast. But I think he's got it figured it out.
Nancy didn't mention this, but isn't there an art series at the library also that the Friends support?
The Friends support that. That's always in March. So in the fall, we will do some cultural programs with history and religion, and also music. And then in the spring, we have the art series at St. Irene's and also the health series.
The art series is held at St. Irene's only because it's so popular that it won't fit into the Hollis room at the library.
Right.
So why don't we let Lucilia tell us a little bit about how her organization helps all of our seniors.
Well, you mentioned earlier, and welcome, Lucilia.
Thank you.
Great. You mentioned earlier fraud and abuse, and that's something that takes many different shapes. It can be fraud and abuse about computer technology. It can be fraud and abuse about identity theft. It can be a lot of different shapes and forms. And one of them that is ramping up, we think, right now is on healthcare issues and identity theft related to that. And what is triggering it, we think, maybe, is that a new Medicare card will be issued to everyone shortly in the coming weeks. And the people that are ne'er-do-wells will want to try to get ahead of that and look at your old Medicare card maybe and try to get your Social Security number, which is your old Medicare number. So I'm not, Lucilia, you know a lot more about this than I ever will. So can you tell us a little bit about overall what the Mass Senior Medicare Patrol Program is that you direct and what its focus is and mission is? And then give us an update on what's happening with the new Medicare cards being distributed.
Sure. So the Massachusetts Senior Medicare Patrol Program is one of 54 programs throughout the country. We are funded by the Department of Health and Human Services, and our mission is essentially the same. It's to reach and educate Medicare beneficiaries, their family members, caregivers, about preventing healthcare errors, fraud, and abuse. Healthcare errors, fraud, and abuse cost American taxpayers anywhere from $60 to $90 billion annually. And if you put errors, fraud, abuse, waste, overusage, all into the same pool, that number can mushroom well over into well over 250 billion, if not higher. So the number that we use, 60 to 90, is quite conservative. And healthcare errors, fraud, and abuse happen in a host of ways. And what I like to impart upon our viewers and elders, people who receive Medicare and Medicaid and all healthcare consumers, is the importance of being very engaged and vigilant about our healthcare, to be very observant, to be very present for any healthcare encounter, and to keep a healthcare journal. So the Massachusetts Senior Medicare Patrol Program actually has journals, and we, when we do a presentation, we always give consumers a journal, a brochure, and a pen, so that they can keep, I call this our toolkit, to start taking note of what is happening to them with the healthcare system. And it's a good habit to get into. You don't have to use this notebook if you don't like this toolkit, as I call it. You can go out and get yourself a cute-looking journal. Keep a binder, keep a folder. All of these documents really need to be kept. And people need to look at their Medicare summary notices, so we educate people on how to review their Medicare summary notices and their explanation of benefits. And to make sure, one, it belongs to them. Did I see this physician? Do I know this physician? Did I have this encounter on this particular day? Does anything jump out at me? Are there any discrepancies? And if so, to follow up on them. Call your provider. See what's going on. Call the SMP program. I think we're going to be sharing our number, but I will give it out. It's 1-800-892-0890, and that's the number for the Senior Medicare Patrol Program. We are a statewide program. Our offices are at Elder Services, the Merrimack Valley. We are under their leadership.
In Lawrence, is that in Lawrence?
Yes, in Lawrence, but we're all over the state.
Right.
So I'm here today, but there are people, in other cities and towns doing presentations or doing casework on behalf of constituents who have issues, who have complaints, and we are seeing an uptick in complaints coming to us. One is partly due because of our outreach and education out in the community. But I think also, as you alluded to earlier, I think that the fact that we are getting a new Medicare number might be an indicator that people are being targeted. Yes, you're getting a new Medicare card. And so people might be being targeted at this point, seniors. And in fact, we've gotten calls from the community to say, I just got a call from somebody who called to confirm my Medicare number because I'm getting a new card.
But they shouldn't be getting those calls.
They will not be getting those calls. Medicare and Social Security will not be calling people to confirm numbers. They typically don't call individuals unless a complaint has been initiated by the consumer and Medicare's calling them to follow up on something. But even at that, I advise consumers to say, okay, can I have your name and your number and I'll call you back. Don't engage in these dialogues. Hang up. Nobody can expedite the process. There's 58.5 million individuals throughout the country that will be receiving new Medicare cards. And between April 1st of this year, it has already begun, through April 30th of 2019, okay? So that's a humongous
Yeah, if you think about
undertaking.
it's like it wasn't too many years ago, 10, 15 years ago, where our Social Security numbers were on our driver's licenses. And I'm sure other states have done what Massachusetts has done and removed this Social Security number. Now we have an alternate number.
Exactly.
But except this one is happening nationally, so it's a bigger.
It's a bigger task.
Bigger
It's
task.
a bigger undertaking. So it's going to take, in Massachusetts alone, we have 1.2 million beneficiaries who will be receiving new cards. So this will be taking some time. There may be some glitches. I think people need to be patient. They need to call if they feel that there's been a glitch in some way. So you, Carrie, may receive your card at a different time than your spouse in the same household. So that's, that could happen. So don't get nervous about it. If people don't receive a card by the 30th of April of 2019, then they really should be, calling Social Security, calling Medicare, calling us. The one thing that people have to do is to make sure that the address that is on file at Social Security is their current address. That is the only thing that individuals need to make sure of. All right?
So they can, is there a number they can call to?
Yes,
Social
there is. So
Security
the number they can go to www.socialssa.gov, or they can call 800-722-1213. All right, that's the number for Social Security. And just confirm that the address on file is the address that you're currently living at. That's the accurate address. All right?
If anybody, sorry to interject here, but
No, please.
just in case people hear that information and couldn't write it down, it is actually on page 6 of our current newsletter. There's a little blurb about it with the information.
Thank you.
Not the full explanation you're giving,
Right.
but at least some of the information with the phone number for Social Security Administration.
So the cards will be paper, just like the former card, okay? There's been lots of talk about why is it not a plastic card? It's very expensive, again, a very expensive undertaking. So it will look almost the same. It will have 11 digits and letters. It'll be made up of 11 digits and letters. There will not be a signature on the card. There will be no need to sign the new card. And there will not be a gender on the card, okay? So currently, it indicates one sex, female or male. That will no longer be on the new card, nor will there be a need for a signature.
Is there any naming convention of any kind?
I'm not sure.
In terms of your personal name?
Your name will be on there, the name that's on file for you.
Right.
But the purpose for this new number, it's going to be a randomly issued number made up of numbers and of digits and letters. And the reason being so that there is no way to identify that that number is actually associated with Lucelia or, you know, the individual that's being issued to. So there's no real way to trace that back to an individual. And that's all to prevent identity theft. You
And
know,
with the original cards, the date, the effective date of entering the Medicare program was on there. Will that be on there as well?
yes, that will be on the card. So one very important thing to remember is that once you get the new card is to destroy the old card, okay, and start using it, okay? So that's very important. The other important aspect of this is that if one does not receive their new card by the 30th of April of 2019, the old card you'll be able to use the old card through December 31st of 2019.
So there's some overlap.
So there's some overlap, so people don't need to panic, okay? So those are, and the most important thing to remember is that benefits will not be impacted in any way. There will be no changes to people's benefits, all right? That's another thing we're hearing, that individuals are calling and using some kinds of scare tactics. There will be no changes to anyone's benefits.
So anyone calling me and saying, I'm representing blah, 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 and I really need to know, because we're getting ready to send your new Medicare card to you, and I really need to verify your old Medicare number before I do that.
I'm not interested in hearing what you have to say. Hang up and give us a call, okay? Because it's important for us to know where in the state these calls are happening, okay?
Yeah.
Geographically speaking. And so we report this out to not only the Senior Medicare Patrol Program on a monthly basis, but we also report this out to the Centers for Medicare and Medicaid Services. Okay, so that's an important aspect of the message. So let us know. We want to know that.
So we want to make sure there's no vulnerability during this period of change.
Yes.
And irrespective of that, we want to make sure that there's no fraudulent use of your Medicare information or
Right.
charges being charged to you or your insurance company.
That's our concern on a daily basis.
That's an everyday
That's a
thing.
mission of our program, right? That's the core mission.
And that's where the $100 to $200 billion of fraud and abuse.
That's
really
where the
takes
60
place.
to 90 billion go towards fraud on an annual basis.
Yeah.
And we all have a role in this. You know, we all need to be protecting Medicare for ourselves and for future generations. Just think of all the programs that we could have if that money was not being, you know, literally thrown down the tubes,
Right.
right?
Now, this is a tall order that you've got. I pulled one of my, they call it an EOB, right?
Explanation of benefits.
And so you'll get an explanation of benefits from Medicare, right? Something like this.
Yeah, it's called the Medicare Summary Notice,
Medicare Summary Notice.
okay?
And it has a lot of information and a lot of footnotes in it as well. And as I was reading through this, I looked at my own and I thought, I know I got that eye exam, and I know I had a visit on, the 14th, but I don't recognize the names of many of these doctors that are on here. In many cases, you'll be seen by a doctor who you know, maybe your primary care physician or someone actively managing a problem with you. But there are also tests that are done ancillary to that, where the test might be done down in the lab and someone
Right.
else's name might be on there, or the test might be an x-ray, someone else's name is
So
on
you
it.
could have a radiologist reading your x-ray, you could have an anesthesiologist, looking, giving you anesthesia, and you won't remember that person, you might not remember seeing him, or him or her. So those are probably very valid, but you're right to question it.
So I shouldn't be too concerned if I know I'm engaged in the process of some kind of a treatment plan.
You should be always concerned, okay? And if, for some reason, I say to people, trust your gut, use the gut test. If something doesn't feel right, typically it's not, all right? So give us a call, okay?
Well, Lucilia, is there a sort of an area that's prone to fraud and abuse, like?
Well, I don't want to demonize any particular sector or the healthcare field, but we see an increase in people being targeted with braces. We have just resolved 3 or 4 cases around braces where individuals were sent braces.
Dental braces or braces,
No,
leg braces?
for the body,
Okay.
for the,
Back,
carpal
knee,
tunnel,
elbow.
knee, yes. And, and those braces are sent out to individuals to the tune of almost $3,000, okay, depending on the number of braces and the body part that we're bracing. And so Medicare pays 80%, and that number is representative of the 80%, plus the supplemental insurance, the 20% portion of it. So I caution people that, you should be seeing your physician if you feel like you need a brace of any sort. You can't make that judgment call. That should be done by your physician at a physician's visit, and the physician should be ordering that. I know that there's a lot of ads on television,
Well, there's also phone calls.
a lot
I
of
know
cold calling. I
yeah.
get those calls myself for diabetic supplies and for braces and.
And the thing is that we had a program just within the past couple of months. It was about wheelchairs, and I think that it's similar with braces. A lot of this stuff should be these days more individualized.
Yes.
So it's not a one-size-fits-all thing, and the technology has made it easier for customization, so that when you have an issue, your wheelchair or your brace is set up for you, so that it will help you, improve your quality of life or improve your rehabilitation.
Right, and there are measures put in place by CMS that, durable medical equipment companies, you need to go to someone who is authorized within your zip code service area. And people are getting around that, because I'm seeing it. So people need to be absolutely cautious. We see bills for individuals who have never stepped foot into an institution, and they get a bill from that institution because of a mix-up in names and numbers. So people need to be very vigilant about that. That's why the journal is so important. Really understanding. And if you're not engaged and you're not looking at that Medicare summary notice or that explanation of benefit, and no money is coming out of your pocket because you're not receiving a bill, that can just go by the wayside. And we need to be very present.
On the braces, for example, it could very well be that you were prescribed a brace legitimately, and they wear out occasionally, don't they? And so they need to be replaced. And this replacement cycle of can you get into
I haven't seen that.
No.
I think that people need to be vigilant. You remind me of a point that I should be making is that, so for example, let's say you get a wheelchair assigned to you, you get charged for a wheelchair, and it really shouldn't have been yours. It was for somebody else, but it got, your number was billed for it, your Medicare number. And you need a wheelchair within the next 5 years, you're not gonna get one because you already have one. So, so on some level, we need to be vigilant because by having our numbers tampered with, our healthcare needs are also being tampered with. And so we need to be vigilant about that. We need to understand that. I think for a long time, people have really not understood the health benefits eligibility maze, and they're understanding it a little bit more, or being more proactive about it.
Well, with keeping a journal, it's vital that you
Vital.
do it immediately. You have it with you and you do it immediately because, I know from my perspective, even when's the last time I took my meds, if I don't write that down, I forget quickly and then it's gone forever.
Yeah, we
So
all
you
forget.
need to be right on top
We all
of that
forget.
and have it with you whenever
So
you
I'm
go.
my mother's healthcare proxy, and I write down on a daily basis what's going on with her. I go to the assisted living to see her. I write down, well, she refused her meds, or she was given one pill too many, which has happened. We just need to be, and these things don't just happen to Lucelia because I happen to be the director of the Senior Medicare Patrol Program. They're happening to everybody. And we need to be vigilant. We need to be very watchful. We need to be very engaged.
So when you do suspect that something's is amiss, who do you call
So-
again? And
So
how do
you
how do
can call the
start?
Senior Medicare Patrol Program, and I'll tell you what we do with this information. We have a national database that we put this information into, right? And we collect the information from the individual who's calling, what their concern is, we write it up, we have them sign a release of information, and we ask them for copies of the Medicare summary notice and/or bills related to the complaint that they are calling us about. And then we begin the research, and we have some very astute and dedicated case managers who do this on a voluntary basis, I might add. So if there's anybody out there who wants to volunteer, we welcome you. And we offer training and ongoing training.
So you don't have to have a nursing background. And
No, you don't. You don't. And we welcome all. So what we do with this information is we put it into this national database, and we follow up on the case. We keep track of those notes, the dollars. And at the end of the calendar year, we report the dollars that we were able to recoup. All right? We have to have documentation for every dollar. It could be $10, it could be $1,000, it could be $10,000. We need that documentation to back it up. And at the end of the calendar year, the Office of the Inspector General lifts a report for each one of the Senior Medicare Patrol programs, and then is able to report to Congress how much money we have saved to the overall program.
So
Now, a
some-
lot of the work, sorry.
Some of these procedures, for example, are 10 times more expensive than you think they ought to be, right? And is there any kind of red flag that should go off that way for people looking?
So providers always bill whatever amount the market amount, all right? Medicare will only approve, Medicare has an approved amount. And providers know what that approved amount is. They bill out what they typically bill out. Medicare has an approved amount, and Medicare pays 80% of that approved amount. All right, that's just how it works.
Right.
And so, and then the other 20% gets paid out by the supplemental insurance.
Or the
company.
patient, right.
Or the patient,
Yeah.
right, because some people don't have a supplemental plan.
Right.
Yes. So I want to go back to what we do with these cases. So we capture all of this data, and then, so it's important to call us. And the reason being, even if you call your physician and your physician says, oh, we're so sorry, we fixed that error, all right? We are refunding Medicare. You may not have that information at your fingertips that in fact has taken place. So one of the things that we do is we track that and we report it to the contractor for whatever part of Medicare has been billed. So Medicare has a contractor for Part A, B, and D. And we then report, and durable medical equipment, and then we report that out to them and say, Mr. Smith has this complaint, we've done this much work, here's all the information. And what happens then is that the contractor actually investigates further to make sure that Medicare has in fact gotten their payment. The payment has been retracted and submitted back to the Medicare fund.
So in order to submit a claim, I need to have a copier, right? In order to do that, because I need to make a copy to send it in. I don't want to send my original EOB
Right, you don't
or
want to send your
explanation of
original, we
benefits.
want you to
So
send us a copy.
Can I come into town hall to get copies made? Can I talk to?
I think we work very closely with the councils on aging, and the councils
Absolutely.
on aging refer cases to us. I'm sure that they would make copies
Yeah.
and send them to
We'll
us.
fax them,
Yeah.
whatever the Senior Medicare Patrol says is the right way to get it to them, we'll do that.
And or the Shine representative could help take
Right.
a look initially?
Work
maybe?
very closely with Shine as well.
Yep. And we have an amazing Shine counselor. And he's been very helpful for people, not only signing up for new insurance, but also when they've gotten bills that they're not quite sure of, he's helped them with that.
Right,
Great.
good. There's plenty of support. Don't hesitate, basically,
Right.
right?
Yeah, I think sometimes people do hesitate and they feel embarrassed to ask them questions, but don't, because this is so confusing.
And it's confusing even if you're not a senior.
Yes.
Medicare and billing are confusing, period.
Very, very confusing.
Yeah.
So when I go to the doctor and my doctor says, well, you probably don't need a test. Do you want to go for this? I'm like, yeah, no, I don't need it, because I don't want to deal with the paperwork oftentimes. It's very confusing, and it's very bureaucratic, our healthcare
When
system.
the last message you ever receive is, you may or may not be billed for this service.
Right.
It's like, how will I know,
Yeah.
So it is very.
Yeah, so my word to people is don't feel like you shouldn't be asking questions. You know that idiom about no question is a stupid question? That's so true, especially when it comes to healthcare. All right? People, in fact, should prepare their questions. In our journals, on page 48 of our journal, we've joined forces with the ABIM Foundation, and we have 5 questions that people should always be asking their physicians. Do I really need this test or procedure? What are the risks and side effects? Are there simpler and safer options for me? What happens if I don't do anything? And how much does this cost? And will my insurance pay for it?
Did you guys see, this is so on target, the 60-minute report, I don't think it was last week, the week before, it was about payment for prescriptions, and there are cases where, particularly with older medications, where if you don't submit through your insurance, it's cheaper at your pharmacy to get it without the insurance. So, for example, prednisone, you might have a $20 copay. They use this as an example. Your copay for $20 through your insurance, and you might not consider that unreasonable because, you could pay a lot more in copays. But in fact, the generic version of prednisone, it might only cost $6. That was the direct example that 60 Minutes, or maybe it was the local news, I can't remember, but they were using. Did you see that? Or
I heard it.
Yeah.
I didn't see it. It was on television.
But the scary thing is, the reason that's triggering this memory is that the pharmacists are not, in many states, are not allowed to tell you that there's a cheaper alternative other than your insurance. They are
You have to
allowed.
ask.
unless you ask. They're allowed to tell you if you ask. So if you ask, they're allowed to tell you, but if you don't ask, they're not allowed to say anything.
Well, in Massachusetts, if there's a generic available, they have to prescribe the generic.
But that's not
That's not the case
that's not
across the country.
But that's not this situation. This situation is it cheaper to pay your copay through your insurance or not to go through insurance at all because the drug is just less expensive than what the copay would be?
Well, in any event, I think the,
Pharmaceuticals are that's another topic for another day.
Right.
It would
Yeah.
take all day.
but in terms of patient rights,
And asking questions is a good thing, I
It's
think.
very,
Right.
you've got to ask questions. And you know what? You can ask the question of your physician around meds, and you can ask the same question of the pharmacist. And if you get different questions, different answers, excuse me, then you need to, ask the same question again to the same individuals and get them to confer because, it's, what's the right answer? What should I really be doing? And, one may never have been the CEO of a company or the president of a company, but you are the CEO and president of your body. And you just need to sort of go in with that attitude.
One of the other things that we've heard is people calling and saying, we need this information, and you can't just say, tell me who you are and give me your number. You have to make sure that the number that you are going to call is the number that's the on the website for that company, because
Thank you for saying that.
some people will call and say, oh, I'm from Social Security, I'm from Medicare, you need to call me and do this, and maybe it's legitimate, not likely if it's Medicare or Social Security, but maybe from a doctor's office or a hospital. But you shouldn't be calling the number that they give you. You should be going to the website or calling the COA and getting the main number and getting to them that way, because some of the people just give you the number of the scam, and you're calling back and getting the person who's scamming you.
So scammers are, way ahead of us. This is what they do. And people need to be, you're so right, that, if I'm out to scam, I'm going to make sure that the number you're calling is the number I want you to be calling. And
they
I'm going
sound
to be
very,
answering.
very legitimate. They
Yeah,
sound
they
very
sound
legitimate.
very legitimate.
Right.
Very legitimate.
Well, this is everybody's task. Everybody should be on your team, basically,
Yes,
right?
this is teamwork.
Yeah.
This is absolutely, you're right, teamwork.
And I think people do, I think what Lucilia said is you need to protect yourself. And if you don't look at your Medicare statements and review them carefully and make sure that there's nothing on there that shouldn't be, you may find yourself unable to get coverage in the future. So it's not just protective for the government's sake and
No, it's
our
for
own
you.
future, it's for yourself.
Yeah.
Well, and if you want to be purely selfish, even as a younger person, of course, your parents or grandparents could be involved, but it's your tax dollars. Medicare and Medicaid are expensive programs for our government.
Absolutely, and it's your Medicare. If you want to, I want Medicare there when I get to that age,
Right.
Right, and there's a chance it might not be if we don't all do
What we need to
do.
Yep.
Right.
So where can I get a journal?
I have one right here for you.
Oh, great. I'll take it.
You can call the Senior Medicare Patrol Program, and we will gladly send out a journal.
800.
You can get journals at your local councils on aging.
Oh, we got
And if
them
they
here.
don't have them, they'll get them from us.
What's the number?
We have a few.
1-800-892-0890. We also have these journals in multiple languages. We have them in Spanish, Chinese, Korean, Portuguese, Russian.
Is there any way we can send, the COA can send them out to folks?
Sure. We send out the little cards for the file of life as well. So if somebody doesn't have a file of life on their fridge, fridge that lists their medication, that's something else we'll send out, or they can stop by our office and pick up one.
Great.
You mean if somebody calls and said, I can't get there, can you send me one?
Right.
Would we drop it in the mail? Yeah,
Yeah.
sure.
Okay, so it's a nifty tool. It has an area to write down your medications, questions to ask your physician, how to prepare for your exam. It has a lot of,
And it fits in your pocketbook if you're a woman.
yes, and I think it fits in the man's pocket, too.
It's a great habit to form.
To get
Right.
into, yes.
Absolutely.
Definitely,
Yeah. Make it a habit.
definitely.
Keep it up to date.
I tell people, even with
Do it in
children.
real time. Yeah.
When I do presentations, I tell them, give your grandchild a little notebook and get them into the habit of writing. I had a tetanus shot today, or
Sure. 6 months go by, 9 months go by, and it may as well have been 5 years. I mean, it's hard to remember these
And
things.
if you're on the younger side and used to technology, you can keep a spreadsheet. If you don't want to write it down, you can go into your computer or your phone and just enter it into an Excel spreadsheet.
I started keeping a spreadsheet to determine whether or not it was beneficial for me to get medics, to get supplemental. Because I was paying this amount for the 20% that wasn't covered, but the premiums for that 20% were actually significantly higher. I mean, it depends on your situation.
Sure.
But doing something like this, keeping this will let you also determine whether you're being a good buyer.
Right.
Right, right.
very important.
Well, thank you so much.
You're so welcome.
Yeah,
Thank
it's
you for having me.
great information. Yeah, I know we've had you before, and so it's never going to not be a concern. But with the introduction of the new Social Security cards, the new Medicare cards, I think this is a particularly germane topic.
Yes.
Absolutely.
So, David, do you want to?
Yeah, we're going to jump right into some of our activities because we had this interesting conversation, but we probably only have 10 or 15 minutes left. So we've got a couple trips coming up. We've had a very good spring of trips.
Yeah.
We've had trips to the Gardner Museum. Yesterday we had a trip to the Boston Public Library. I've already seen posts on Facebook from these trips.
Yeah.
I guess some of our crew at the Boston Public Library trip ran into Marjorie Egan, and I can't remember the guy's name, but from the radio program.
David Browdy, or
Yeah, exactly.
yeah.
And so there were pictures of them together with
Yeah,
Joanne Willens and Lillian DeBenedictis. So anyway, Lillian's got a trip coming up Monday, June 4th. It's one of her restaurant review sojourns over to a local restaurant. And this one is actually in Natick. That's venturing out for Joanne, isn't it? But it's a popular place. It's called Zaptig's. It's delicatessen, and I've eaten at the Zaptig's in Brookline, so it's good. A couple of years ago, I remember it being very good. So if you're interested in going to that, please call Joanne directly. Her number is 978-371-8023, and let her know by May 29th if you're interested in going on the trip. Some people want to drive themselves, but rather than use the COA van. But I imagine that since this is going to Natick, that people might want to do the van. Also, we've got a trip to Rockport coming up in July. That's mid-July, July 17th. It's on a Tuesday, and Joanne's leading that. It sounds interesting. It's historic Rockport. There's restaurants there that's described in our newsletter, and it's the first 12 people that can go because we only have 12 seats in our van. So please call and let us know. Or this is July, so you might not have to do that right away, but call by July 10th at the very latest. And it's preferred that this would be for Carlisle residents, but we do know that sometimes if we don't have enough Carlisle residents that register for things, that if out-of-towners want to join in the trips, then they're welcome as well. And let's see what else is going on. Our newsletters have gone from monthly to every other month, so we're packing a lot of information in them. And so we don't want to read the May information because it's already It's already too late. But you've got a couple things coming up.
Right. We
Talk
have our coffee at the Sleeper Room on June 7th, and that's going to be hosted by Life Care Center in Neshoba Valley for us, as well as they always provide us blood pressure clinic that same day. And our senior moments at Ferns, and Ferns is under new ownership, so we're hoping that they will continue supporting us being there for twice a month for our coffees. And this is one of the few programs that we do over the summer, so the second and fourth Monday of every month, so June 11th and 25th will be there. And the social hour is at Benfield, and that's once a month, and that's to get people together and meet new friends and chat and have some refreshments. And so the last one for this season is June 11th, and then we'll stop till September. We're also offering, if you want to get your senior Charlie card, if you're 65 or older and you want to get a Charlie card and you don't have one, rather than going into downtown Crossing, we will set up a event here, right in Town Hall. We just need 15 people, and I think we have 8 so far on the list, so we need a few more people. Our meditation group has really taken off. Tom Dunker started that in March, and it's meeting once a week on Mondays at 1 o'clock at Benfield Farms. So if you want to meditate, we do have a few slots open. We are limiting the number of that, so it's a small group. But if you'd like to join, call the COA, and we'll get you on the list for that. And then the Gleason Knitters will be meeting. They knit for themselves. KISS, which is affiliated with FRS, knits for the homeless. And matter of fact, tomorrow night, Thursday night, is our last meeting for this spring. And then we'll go back to September. But if you're out there and you want to knit a hat or a scarf for a homeless person, please do so over the summer and come and either drop it off or come knit with us in September. And we also have our book club, which is meeting on June 11th. And you can find the book of choice on the library website. David, do you have some other things you want to talk about?
Well, in case this program does go out before May ends, I do want to mention that May is National Elder Law Month, and that we had a very kind offer from a local attorney, Linda Butterworth Till, to prepare health care proxies and wills, living wills, I should say, for the first 10 Carlilians of any age, not necessarily seniors, of any age, who call the Council on Aging and register for an appointment for her. And she's done this for a few years in a row. It's been very nice.
Quite a few years.
Yeah.
She does different documents every year. So we hope, we've only had 2 people take us up so far.
So we do have capacity
we have 8
for these
people
these
that
free.
she's still willing to do.
Sure, I'll tell you, it doesn't hurt to help have these items, and it really sometimes can be very effective
Absolutely.
for you. I was going to mention the new Medicare insurance cards, but there's nothing I could add that Lucilia and Carrie haven't mentioned so very effectively. There is a program coming up called Replanting Lives Uprooted by Mental Illness and Support for Families. It looks like it was run on May 8th, and it's being run again, or is it a 2-parter?
It's a multi-part. This
Okay.
is like the 6th session. It's a support group for families that are suffering with mental illness.
So that presentation is going to be at the Gleason Public Library on June 12th at 10:30 a.m. That reminds me, on the way in, on the car on the way in, just so you know, I'm trying to be productive. We are advocating for a line item in the state budget that it's actually an amendment to the Senate's version of the state budget that would allocate money for behavioral health for seniors. I think it's $500,000 across the state. And so I called my local senator on the South Shore, John Keenan, And because I'm a resident there, I could call and say I'm a constituent. I did identify that I'm the Council on Aging Director in Carlisle, but I don't think that holds very much sway. I think they want to hear from residents who are their constituents. I wasn't going to mention it because I don't want anything to appear too political, but I do think that supporting mental health and that includes treatment for addiction, in the long run is not only necessary and helpful for people and families, but it is cost effective. It treats situations before they become even more expensive for everybody involved. So anyway, I'm glad. This is one of the great things, one of the many great things about Carlisle, but we have some wonderful, wonderful speakers, especially at the library.
And this started when Mara Briere came here for CCTV. And when we were talking, she was willing, to set up a monthly support group. So this came out of a CCTV show.
And then also in June, on Saturday, June 9th, between 10 a.m. and 3 p.m., there's a Pay It Forward Day. No act of kindness is ever wasted, is their tagline. There's an article in the Mosquito about this, and it's occurring at the Carlisle Transfer Station.
Right.
I gather you can donate usable clothes, household goods, bicycles.
No, not bicycles.
Oh, I'm sorry, not bicycles.
No, we put it in there because it was in there last year, but they're not doing bikes this year. But there's a long list in the Mosquito, or call us. We have the list that Mary Zoll has worked with various agencies throughout the state to get things that they need.
See, the skill set to be a journalist is actually harder than some might imagine in this day and age of
Things change.
Things change, exactly. Angela, you were going to talk. We only have a few minutes left, but you want to talk about some of our exercise programs?
I do, because we need a few people for some of our programs. All of our classes, we require a minimum number of students, and we have these core groups of people that really love them, so we always want to make sure the classes go. And for the summer, we will keep all of our programs going but TAP, because TAP is at FRS and they don't have air conditioning, and we didn't think people wanted to be dancing in the summer. But we do need people for our Tai Chi class, which is on Tuesday. For our, we could use more people for our line dancing and our fitness class. Line dancing is on Wednesday, fitness is on Thursday, and even some we could use an additional 1 or 2 people, which is on Friday. So people can come and try a class out before the new session starts and try one for free. And if somebody wants to take a class and they live in Carlisle and they are a senior and they can't afford it, they can see either David and I, and we can do a partial scholarship thanks to the Friends of the Council on Aging. So, lastly, I think we're running out of time, but I'd like to remind people we have haircuts right in this room. So if you'd like a discounted haircut on June 11th, you can call the COA at 978-371-2895 and get a terrific job done. And our outdoor walking group continues on Thursday mornings at 9:30, and many of the people that are going to the walking group have finished the trekkers, all of the trails in Carlisle.
Great. Angela and David and Lucilia, thank you so much for a great program today. And I want to challenge everybody, start a new habit, starting tomorrow. Start keeping a healthcare journal. And it's very easy to do, and you'll never regret having done it. So thanks to everybody. We'll see you next month.